are driven by pleasure-seeking principle, you tend to act irrationally. And so now you are acting without analyzing the consequence. But what we need is to satisfy what you want. And the belief system you have is that you want to seek pleasure. And now when the consequences now come, you may not even see it if you are an addict. And so now there is that need now to dispute that irrational belief, which you were more of, let me seek the pleasure, let me enjoy the substance. Now we now need to dispute that belief. And now when we dispute the belief, we are rationalizing that irrational thoughts for you to become rational.
Welcome to another episode of African Health Insight. In today's episode, we want to explore the causes and consequences of drug abuse among adolescents in our society. Without wasting much time, I would like our guest to introduce himself.
All right, thank you very much, Elvis, welcoming me to another episode. I am a practicing psychotherapist. I am very grateful to be on this platform today.
So can you please share with us your experience working with adolescents who abuse drugs?
What I have experienced is that these adolescents get into substance abuse. You know, when we talk about substance abuse, it means you are taking what has not been prescribed for you to take, and you take it based on your drive of taking it. And now you keep taking it despite the consequences. The experience I've had is based on the fact that most of them are influenced by their peers. Most of them too will want to experiment. When they find someone taking it, a certain substance, they will also want to experiment to see how they will feel about it. And with that, they gradually activate their level of dopamine. And you know, once the dopamine is activated, it is now, that's one of a pleasurable neurotransmitter, which I'm talking about, dopamine, And so now, you now find the person now increasing the dosage of the substance day by day, and not even looking at the consequences. Some of them will want to, they are persuaded, you know, what we call peer pressure. Some of them may belong to a peer, and in that group of adolescents, some take the substance, and now they now put a law that if everybody is not taking, then that person should quit, and now the person now is persuaded now to take.
You made mention of substance addict. What is the difference between substance abuse and a substance addict?
Substance abuse is the initial stage where you are getting into the substance, the initial stage. And now once you get into it and it affects you, it also increases the level of dopamine increases. And now when you are now a substance addict, you are in a situation where you cannot do without it. But that is a little different from substance dependence. With substance dependence, you are looking at issues where for you to speak in public, you need to be activated. For you to speak song or to dance or to meet some people, you need to look a little tipsy. And now there's also substance use. So let's understand this concept. Substance use, substance dependence, substance abuse, and substance addict. Yes, addict now is that profound state of substance abuse where the substance has taken control over your thoughts and over your actions, and you find it difficult to make a decision to pay.
What are those things that push individuals to abuse substances?
We live within a societal context where the society is full of stressors. And some of these adolescents will want to cope with stress-related activities by engaging into substance. and thereby abusing it. To them, it's a coping mechanism. That is the best thing they can do. Some people say they are trying to postpone the stressor. They are postponing a problem that will sting them the next day. Even though we are talking about adolescents, but we should also know that substance abuse too cuts across. Yes, it may not only limit between adolescents, it may also cut across adults and old age. And we also look at issues in terms of peer pressure too. It's also a risk factor, like I earlier said. Being in an environment that is not healthy.
So in our context, maybe the Cameroon context, the African context, where we are, like what are some of those substances that adolescents abuse?
The most common substance that have been abused by adolescents, you have things like alcohol, marijuana, tramadol. Those are the most common. Thailand, it is very rampant nowadays. It's very rampant, and before now, we used to think that only the boys or the men get into substance abuse, but mental health has proven that wrong because we also treat cases of women, of young girls, 17, 18, and other who are also involved.
Yeah, I know in our country, Cameroon, like I don't know if there are policies or regulating the use of substances like alcohol.
There should be a law, of course, regulating, but there's a difference between the law being there and the law being implemented. Who has to implement it, and how should it be implemented? That is why it now causes a lot of adolescents to be driven more by their pleasure-seeking principles in them, and they can take anything, anyhow, and they go free. And now the consequences is like and becomes an antisocial by bringing pain to the community. That is now where they may start looking at where the law is to punish the consequence and not the cause of it.
So you made mention of consequences. Can you tell us more about the consequences of drug abuse among adolescents?
Those are some of the areas that I focus on in terms of assessing how this substance has moved you either forward or backward. I am very happy because my clients will always come up with some of those consequences. First, there is financial consequence. Once you are addicted in taking substance, as an adolescent, you may not have the money to keep buying it. And so now you may now resort to situations where you may now start stealing money from the house. Some of them sell their shoes, their dresses. Some of them even move into the household, they take pots and they sell. I will use the common balance of what some of my clients say. They say they are palming it, meaning that they may not sell per se, they keep it and you give them money for them to buy the substance. So it's not like they are selling and they're not selling. So at the end of the day, they may not still have the money to give you back for them to collect what they pass. Yes. So with that now, it now resorts to issues where they start taking things from the house and they are keeping to take money for substance. Some of them use their house rents. Some even borrow money around. And at the end, their parents are held to pay. Health-wise, they lose weight. That's why each time they come for follow-up, I must use a skill. Yes, I must use a skill to be sure that their weight is increasing. Because once they're into substance, the appetite of eating is dropping. Also looking at the aspect of irrational thoughts, of course, because once abuse client is just coming fresh from taking the substance, some of them find it difficult to control their emotions. That's why you find them being so violent, they have physical violence, verbal violence, and all that. They are not acting in their real senses. With that too, gradually you find some of them hallucinating, gradually moving now to become psychotic patients. You find them deluting, you find them hallucinating as a result of what? Substance abuse.
What is the role of parents, educators, healthcare providers? How can they intervene if they suspect an adolescent, a child, who abuse drugs?
First step of intervening is by acting rationally. I'm saying so because some parents will find their adolescents into substance abuse and they become aggressive on them. For instance, if this adolescent was influenced by his or her peers, it is now time for the parents now to start investigating the kind of friends their children make and also intervene by asking the children to be honest with them, to give them information about what is going on. The next step is seeking help, meeting a therapist to seek help. Most parents have been coming to me with their children, and of course, it has been a good deal between us, and I think I'm confident that they are doing well.
What is the role of educators as well as healthcare providers in identifying some of these children who abuse substances?
Some of these adolescents are in schools, they're in market, they're in churches, and all that. Healthcare providers should set up a very good team to hold programs in terms of sensitizing these adolescents because some of them may not know where to seek help and some of them think there is no help. Based on that, we are looking at a situation where the healthcare providers should set up that social team that can move into the community and sensitize. It may not be a bad thing per se, but what is bad is the way we react towards it. Yes, let's approach it. We may approach the churches, approach the markets, and sensitize that there is treatment.
Have you witnessed some challenges these adolescents face in accessing treatment or interventions?
Challenges I face are based on the fact that these adolescents are abusing substance have all called self-guilt. They don't like their situation, but now they cannot do anything about it. It is also challenging. And then secondly, getting information from them. Because they want to keep information, they don't want to release information that is useful. At times, I also work in terms of the parents too, to see if they can also give me information. And that is why if you're treating a substance abuse case, you must relate with the parent because there is also a home information the parent will give you. In as much as you are treating the patient in a clinic, once the patient goes back home and you're not doing follow-up, the feedback comes from the parents, it comes from neighbors to see if there has been a change. They are persuaded by their parents to come for treatment. Like some of them, I'll ask them if they really want to take a decision to quit. They'll say they want to quit, but their parents are putting the pressure to quit as fast as possible. But to them, they still have some time. It's also challenging when the adolescent is not for treatment and the parents are for treatment. That's where you as a therapist, you find it a little difficult.
What is the role of community leaders in addressing this issue?
Areas where these adolescents gather to take substance. It is in the community, it is in a neighborhood, and there is a head in the neighborhood which we call quarter head. For it begins there, for the quarter head to send out a campaign team, for the quarter head to condemn it before other authorities, probably in government or whatsoever, in synergy with the members of the community, so that they can always identify, because they know where the boys used or the girls used to gather somewhere. Some of them gather in cities. Yes, especially those in the universities. They are in cities and they drop themselves there in the room. Definitely there's a neighbor, and the neighbor knows that this is what is going on. And so that neighbor can inform the elders around so that they too can also denounce it. And from there, we may start having hope of having a positive society.
How do you think we can balance punishment and treatment in addressing substance abuse amongst adolescents?
For someone to get into substance abuse, the person thought of it and the person is acting on it. And so if you bring some sort of punishment like corporal punishment on it, it may take us nowhere. But based on the fact that we are dealing with a decision that came from the mind and is manifesting now in the body, we have to target the mind because it was irrational for the mind to think that way. And so we need to rationalize that irrational mind. And then we also look at issues whereby we have to educate parents. We go to meeting groups and then we give educative talk for them to also pass it on to their children. This is what is happening, and you should be aware. You should be, of course, careful with the kind of interactions you make. Let me also tell you something. Some of these my clients also let me know that some of those who sell these substances don't take it.
Do we have to involve those who sell in managing those who take it? Like, what is the role of those who sell? Because if they don't sell, the others will not take it. So how do we approach this?
Yeah, some people will say it is business, but we are looking at it from the positive aspect. We are looking at it from the fact that it is moving the society forward. If you are doing business and the products are enriching the society, then we need to applaud the business. But now, if the business is taking the society backward, and just like some people will say, the tomorrow lies in the future of the youth, and now the youths are being destroyed because there is a business. Now, where is the future? Who are those who engage into research to move the community ahead? So those are some of the aspects where we also need to denounce those who are selling, not only those who are buying.
So you talk of rationalizing the irrational mind. Can you tell us more about that?
This aspect of irrational thoughts came from one of the renowned psychologists, Albert Ellis, who believes that human beings are completely irrational and that we should not look at a human being to be rational. Now, when a human being is driven more by the pleasure-seeking principle according to the psychoanalytic theory of Sigmund Freud, of course, yes. So when you are driven by the pleasure-seeking principle, you tend to act irrationally. And so now you are acting without analyzing the consequence. But what we need is to satisfy what you want. And so the belief system you have is that you want to seek pleasure. And now when the consequences now come, you may not even see it if you are an addict. And so now there is that need now to dispute that irrational belief, which you were more of, let me seek the pleasure, let me enjoy the substance. Now we now need to dispute that belief. And now when we dispute the belief, we are rationalizing that irrational thoughts for you to become rational.
That's interesting. So, once more, we want to appreciate you for being in our platform. Before we leave our community, we want you to tell us, like, some people who abuse drugs to their parents in our communities who want to reach to you. How can they reach you and how can they locate you?
Yeah, to locate me, you come to the Nkwe District Hospital, the former PMI. You get me. I am the clinical psychologist there practicing, and you can also meet me in school. I have a school called Hamid Training Institute of Science and Technology located in Bamenda, in Cape Town. Where we train even mental health practitioners and nurses. Business studies students are also welcome. And just to end up to say that this aspect we are talking about is a pressing and it's a hot issue in the community. And I want to assure the community that I am competent in terms of, especially in terms of substance abuse. I think that is the area I have hit it, and I think I have confidence to work with some of them. And so we are available to receive their children even to receive them who are into substance abuse.
Okay, thank you once more, and to our family, to our the members, the community. We always appreciate your contributions, your time in going accompanying us through us all our episodes. We appreciate your commitment to this platform. We've been able to go through this content today. We would like you to do us a favor and subscribe to our channel, share to your friends and your own platforms, your communities.